Good afternoon, everyone. Welcome to Adult Care Facilities, Understanding Options for Care. This is part of NAMI Greater Cleveland's monthly community education program. We're joined today by presenters from the Ohio Department of Mental Health and Addiction Services, the Adams Board of Cuyahoga County, and NAMI Ohio to share important and relevant information for many of you, I'm sure, on the topic of residential care for individuals with serious mental illness. So we're definitely going to take some time for questions and answers within the 90 minutes that we have scheduled for this webinar. Please remain muted during the presentation so that we can focus on the content being shared. I will be monitoring the chat throughout the presentation, so please utilize the chat feature if you have questions, and we can address those either during the presentations or at the end. These slides will be made available to you. So look for an email in your inbox after this presentation with those slides. I want to say a few words about our organization, about NAMI Greater Cleveland, before we allow our first presenter to get started and to share her screen. So a little bit more about NAMI Greater Cleveland. We are dedicated to improving quality of life for individuals with mental illness and their families. And we do that by providing education, support, information and referral, and advocacy. We offer support groups for people with mental illness, support groups for families. We offer educational programs. Some are more in depth and occur over 8 weeks. Some are one-time programs such as this one that you are attending today. And we also have a helpline that people can call if they have questions about referral to providers or other resources in the community that can be helpful for a person living with a mental health condition. So that's all I'll say about NAMI Greater Cleveland. I'm sure many of you are familiar with us already since you're attending this webinar. With that being said, I'm going to hand it off to our first presenter, Sue, and we'll allow her to share her screen so she can get our presentation started. Thank you so much for joining us.
Hi, I'm Sue Chaprait. I'm from the Department of Mental Health and Addiction Services, and I work in the housing and homelessness section of the department. And I'm just going to give you a brief overview of residential facilities and kind of what they're about. I know everyone else has more detailed information kind of about some of the programs and things available within these facilities. I'm really just going to go over the definition of a residential facility class 2 and some differences between assisted living and room and board homes and residential facility class 2s and other group homes that may kind of fall under this group home group of things. I'm also going to talk just a little bit about our housing continuum and kind of where residential facilities fit into that housing continuum in our for our department. This is a slide that we like to share when we're doing these kind of presentations to show kind of our directors and our departments kind of dedication to housing, to grow community capacity through independent housing, permanent supportive housing, adult care facilities, which are called our residential facility class 2s, and recovery housing, and kind of for the preservation of these homes and kind of new build as well. For our section in housing and homelessness, we really try to guide our principles for housing under these 8 or 9 items. These principles that we really kind of guide how we look at housing to be safe and affordable, ensure access to natural supports and allow visitors of an individual choice where one is living, to be integrated in and have full access to the greater community outside of the home, be selected by the individual from a variety of housing options, ensure individuals' right of privacy, dignity, and respect, and freedom for corrosion and restraint, include trauma-informed best practices and cultural competence for all staff and residents in the home, optimize autonomy and independence in making their life choices, provide access to available services and supports within the community in coordination with the individual's choice, and to provide for special accommodations or have policies and procedures in place to provide housing for individuals that require special accommodation. So when you're thinking kind of about group homes, you may have different images pop into your head when you're thinking of group homes. In Ohio, group home is a very general term that encompasses a wide variety of homes, all with different licensing bodies and different rules and different regulations.
Speakers off, so you're not going to hear anything.
Are we good? Okay. Perfect. Okay, and then
The video. I don't want to see me. It's just all the people.
Please remember to mute your microphone.
Okay.
Thank you.
Okay. So we asked you to kind of think about those things when you're looking at group homes, and then I'm going to introduce kind of our housing. I'm going to talk about our housing, kind of our housing continuum at Mental Health and Addiction Services. So really, when we look at housing, we're talking about things like permanent housing, permanent supportive housing, recovery housing, the residential care, which is really what we're here to talk about today, and then transitional time limited housing. So I'm not going to go through all these different types of housing and they're kind of how we define those, but they'll be in the slides if you want a copy to kind of look at the different types of housing and kind of where different types of group homes fit and kind of the definitions of these different types of settings. Really, when we're looking at residential care, we're looking at a living setting that includes room and board and personal care. We're looking at program rules and service agreements for the residents. Staffing can be 24 hours a day, 7 days a week. It doesn't have to be. Assistance with activities of daily living in a congregate setting include things like assistance, reminders with medication, assistance with bathing, dressing, things like that. In general, any kind of assistance with the daily activities of daily living. And generally, these are in a congregate setting, which means it's a single site residence, usually a home that provides group living. And the residents may share a bedroom, they may share a bathroom, and they share that living area. Facilities are owned and operated by a private owner, or sometimes they are agency affiliated, or within an inpatient continuum of care through a hospital, mental health agency, behavioral health agency, something like that. This type of housing is licensed by the state of Ohio. And as I'll talk about, there are different licensing bodies that that license different types of group homes. So the one that we're really focused on today are kind of these Class 2 facilities under residential care. And that facility provides accommodation, supervision, and personal care to 1 to 16 adults who generally have mental illness. They can be served for people who are elderly, but really our licensing and our rules and regulations really target that population of people who are mentally ill. Those facilities are licensed by our Department of Mental Health and Addiction Services. There are also a subsection, another licensed facility under the Department of Mental Health and Addiction Services called a Class 3 facility, also called a residential Class 3 facility. And those are more focused on just room and board for persons with mental illness, they really lack that supervision and that personal care piece the Class 2 facilities address. Again, these are licensed by the Department of Mental Health and Addiction Services. Again, 1 to 16 residents. You'll also hear residential care facilities referred to under the Department of Health. And these are really, when we talk about those, we're really talking about assisted living type facilities. They are 24-hour programs that include accommodations, housing, meals, laundry, transportation, social and recreational activities, personal care services, supervision, and they are allowed to provide skilled nursing care to individuals who are dependent on those services. They can be called assisted living facilities. You can hear them called residential care, and they really target facilities that have adults living there that 17 people and above. Those facilities are licensed by the Department of Health and are not licensed by us. So under us, we have these Class 1, Class 2, Class 3. The Class 1s are really treatment oriented. They are owned and operated by a behavioral health provider. Again, we're really looking at this highlighted area of Class 2 facilities that again provide accommodation, supervision, and personal care services. And they are service 1 to 16 adults. This is our map of the licensed residential Class 2 homes in Ohio. As you can see, for your county that we're talking about, Cuyahoga, you have almost 1/3 of the homes in Ohio are located in your county, with about 330 homes, plus or minus. They're constantly opening and closing, so that number is kind of rough. A really quick overview of residential facilities. Again, there can be publicly or privately operated homes that provide room, board, and supervision, personal care services up to 16 residents. They are congregate settings with single or shared bedrooms and a shared living space. They are not a treatment setting, and the operator cannot bill services to Medicaid. We like to say that this setting is environmental, not clinical. And again, they are licensed by us. The population that resides in a residential facility Class 2. So many of the individuals living in these homes have a serious mental illness or a co-occurring substance use history, or are elderly. Individuals who live in these facilities need accommodation, supervision, and personal care. The homes typically offer support and assistance with daily living skills. And individuals who live in these facilities without this level of support may be homeless or inappropriately residing in nursing homes, extended hospital stays, or might be incarcerated. So these are just some of the other types of residential care facilities that you'll hear about. We already talked about the Department of Health and kind of what those are about. There are also residential facilities licensed by the Department of Developmental Disabilities, and I have included a link to those facilities. They are licensed by the Department of Developmental Disabilities, and really are operated under a different set of rules and regulations. You may also hear about children's residential centers, group homes, and residential parenting facilities, and those are really licensed by the Department of Job and Family Services, and again, operate very differently than our homes under different rules and regulations, and I've included that information for you there. So this information will be in the slides. If you're curious about some of these other group home type settings, they are there for you to look at and find online. So that's my very brief overview of residential facilities. I didn't want to take too much time because I know other people have more in-depth information for you. But if you have any questions, I'm happy to answer.
Yeah, any questions before we move on to our presentation from NAMI, Ohio? And remember, we will also have time for questions before we end. So if there's no immediate questions, I'm not seeing anything in the chat. I think we can move on to Zach and NAMI, Ohio's presentation.
All right, thanks for joining today. Let me go ahead and get pulled up here. Okay, there we go. All right, hi everybody. My name is Zach Johns. I'm the coordinator for the Ohio Adult Care Facilities Association, which is through NAMI, Ohio. Go and get started here. So who we are a coalition of basically operators, as they're referred to, or the facilitators who run these facilities. We have a coalition of at least 250 plus, where we represent the Ohio's residential facilities class 2 industry. We hope to continue to improve the quality of services and care that the individuals that reside in these homes or in these facilities that they receive, as well as to provide training, education, technological assistance, and advocacy for this purpose. And I also left a link here for those who take away a copy of this presentation, where you can look us up on our website at both NAMI, Ohio, and under the Ohio Adult Care Facilities Association. So just a little bit of an insight. These are actual real stories. We changed the names around just for privacy and HIPAA and stuff like that, but just to kind of give you an insight of who actually resides in these adult care facilities, or ACFs. So a man who was an alcoholic, who was alienated from his family, who also struggled to understand his underlying mental illness. George, as we were going to call him, was living in a group home provided the perfect setting where he could flourish. George has both been a resident and a family member now for 30 years, with a sense of belonging and compassion. George has achieved sobriety and takes great pride in his volunteer work at his beloved Salvation Army Church. Another instance or example would be tormented by his undiagnosed mental illness. Dave survived in the wooded areas around southeastern Ohio for nearly 2 years. He slept in a post office hallway on cold nights and relied on free church meals and clothing giveaways to survive. Dave's life changed forever when he agreed to live in a group home. He had found comfort and an improved quality of life within the group home itself. He expressed gratitude for being a part of the family. And even in the end, when Dave was in hospice care and ultimately lost his battle with cancer, his home operator was by his side, allowing Dave to feel the love and support that only family could provide. So this is our housing locator that is through the association. This is pretty much our marketing and referral tool. Ever since I started, which would have been March of last year, I've probably made well over 30 plus referrals through our housing locator alone. Typically, I'll get calls here in Franklin County, or even up in Cuyahoga County, Cleveland, pretty much all over the state, with people, kind of either need an education on what residential class facility 2 is, what kind of capacity they have throughout the state and different regions of the state itself. It's also a good tool that I use between the operators in terms of them, being able to market their homes, updating any capacity that they have or availability. Anything from bed count to specific target, demographics that they go for, whether that's strictly male or female homes. And certain facilities are licensed for, anywhere from 5 to, I want to say 10 or so beds, typically, mostly 5. But it's a great tool that we use for both referral and marketing process. I also left a link here that's specifically for homes in Cleveland. So if you were to click on that link, it will bring you to all the facilities that we have so far. And as Sue has said or pointed out, we do have the majority of homes in Cuyahoga County. So there's definitely not a shortage of beds or any availability. And this is kind of what that view would look like here when you get to the website. It's pretty much a filter system you can go in through, by city, county, even financial things, whether that's trying to find RSS or private pay, depending on your financial situation or what you're looking for your loved one. And you can also see a regional map here on your bottom right that you can kind of poke around with, zoom in, see what different areas throughout the state offer that type of capacity. But as you can see in the top right corner there, Cuyahoga definitely has the abundance of the homes that we represent. Just some statistical facts. Oh, I did not mean to do that. I'm trying to move the little passport thing out of the way. There we go. All right. So out of the 300 plus facilities in Cuyahoga County, there is plenty of availability of ACFs. These are actually some photos of some of the adult care facilities we have up that way. And also, if for some reason, in the instance that you're not having any luck trying to find availability, neighboring counties or cities such as Akron, Canton, Toledo, even Erie County, those have the capacity for ACFs as well. All right, so Matt actually gave me the pleasure of giving me some prompts to kind of go over with you guys that I thought were pretty beneficial, or at least, deserve some sort of clarification, as I've had plenty of these questions asked to me as well. How do I get this bar to disappear? Okay, sorry, the bar is blocking out my current view, so I'll try to read this as best I can. Anybody know how to get rid of the bar so I can read?
The first question was listed as, are the group homes located in a bad area?
Yes. Okay. So this one's definitely a common question, especially here in Columbus, where seemingly a lot of our, adult care facilities are in the most desirable parts of town. This can be due to a lot of variables, such as redlining, property and value taxes being either way up or way down. The demand for settings in those areas that lack in community resources, transportation and accessibility for those that are in need of services. Even if an ACF is in a non-preferable area, it does not indicate or reflect the type of care as well as supervision that they will receive. Furthermore, due to the stigmatization of group homes, as many of you are probably aware of, many affluent suburbs view ACFs in a negative way, unfortunately, which is preventing the future development of ACFs from ever being put in place. What can a group home offer? A group home offers stable living conditions, routine, which is definitely important in the lives of those affected by mental illness, supervision, and above all, a place where an individual feels like they are part of a family and can eat and rest comfortably. How would a group home benefit my loved one? It could benefit your loved one by offering quality care and supervision, bonding with other peers within the home and forming long-lasting friendships, being able to allocate and navigate community resources and systems with the help of your operator or staff members, as well as case management services that can help increase independent living skills for that individual. I thought this was a great question. Once you enter a group home, are there resources to help transition out of it? It all depends upon the stabilization. And I put desire, but I would say it's pretty much just where they're at in terms of independence living. Some people may be in a group home for anywhere from, a short stint for a few months to a few years, whether they're waiting for, say, a housing voucher or something like that, where they may move on to a different setting, whether that's more independent or not. There have been many success stories where residents have resided in a group home, and through the efforts of the operators, staff, and other support systems, they were able to maintain employment or use other benefits to obtain stable and independent housing. And again, it all depends on this individual and their circumstances. Are group homes only for people who struggle with substance use? What populations can use them? No, group homes are not only reserved for those who struggle with substance use or substance use disorder, SUD, if you will. We are seeing an increase in individuals who have co-occurring diagnoses such as mental illness and substance use disorder that are being referred to these homes. Though there are a range of different settings that can be referred to as a group home, such as senior facilities, or as Sue referenced, DODD facilities. Class 2 residential facilities are predominantly for those living or suffering with mental illness. Okay. Matt, would you
It says, yeah, what are the costs? Are there sliding scale fees?
Yes. Okay. So it can fluctuate due to income or benefits, but typically with residential class 2 facilities, it comes down to pretty much private pay or the residential state supplement or RSS subsidy. This can cover, so it basically enacts with one's SSI or SSDI benefits, where basically the state will pay a portion and then the rest of the benefits cover the rest of room and board. This could be covered up to $1,100 a month. as well as supplying the recipient or individual that lives in the home with $200+ dollars of spending money per month. They typically use it for cigarettes, coffee, other things like that, or even lottery tickets, but it's their spending money. They can use it for whatever they seem fit. But typically that check goes straight to the operator or the facilitator of these facilities to cover room and board. So left a link for the RSS information on here as well for anybody that wants to look into that in terms of the application process and other eligibility criteria. But most importantly, most operators are willing to be flexible when it comes to cost of working with payees, guardians. They're very familiar with that process. So be sure to have those open discussions with them to see what works best for both parties involved. Do you need to have a mental health condition to stay in a group home? And I found this surprising. Technically, anyone can reside in a group home with how the framework is laid out. You do not need to have a mental illness to reside in this type of setting. However, most individuals that reside in these facilities typically have severe and persistent mental illness or SPMI and require supervision as well as additional supports. How long do group homes allow you to stay in a group home? Kind of circles back to the last slide. It all depends upon the individual. Some residents can reside in a group home, anywhere from 10 to 20 years, maybe even half their life. I've met individuals who've been in, with an operator for anywhere from 25 to 30 years, which is mind blowing to me. It's hard to believe someone being in business for that long, let alone, taking care of someone for that long where they really become a part of a family. Others may or may not ever have the capacity to function completely independently. Permitting an individual isn't causing any issues or breaking the rules of the facility laid out by the operator as well as the department. A resident could stay for as long as necessary. Do they accept any form of insurance? Unfortunately, at this point in time, group homes do not accept insurance as a form of coverage for room and board. And lastly, thanks for bearing along everybody with these questions. I just figured, based on frequently asked questions to address them. But number 10, what kind of amenities are typically offered in a group home? You can expect home cooked meals, personal care and hygienic items, day programming through community resources such as behavioral health agencies, laundry services, television, Wi-Fi, board games, or other card games and stuff like that for entertainment, dining out at local restaurants, going into the community with other residents to engage in social activities, taking planned vacations across the country during spring and summertime, as well as each home and operator are different in terms of what they offer and can afford to provide. So this is also another common question I get in terms of, when I'm doing the referral process and getting, loved ones or those who are interested in a group home facility or a group home setting, how to gauge what would be the best fit for my loved one. How do I make sure the dynamic is right? And I always say, get to know the operator, pose prompts such as, what got you into this industry? What are some of the biggest rewards and or challenges? And what do you enjoy most about being an operator? Typically, you'll get pretty good responses. And surprisingly enough, a lot of people that are currently doing operations, they have family members that either started and they're kind of carrying on that tradition, or they have loved ones that themselves have been affected by mental illness. So it keeps them motivated. Typically, you won't find people in this industry, as bad as this is to say, that are in it for the money. Typically, they're doing it out of the kindness of their hearts. And again, these types of questions will give you an idea of the type of caregiver they will be for your loved one. Other questions you can ask, kind of mentioned before, what types of amenities do you offer? Any diet modifications covered, especially if someone has an allergy or an intolerance to something. What community resources are available within your area? Do you accept RSS, SSI, SSDI, or private pay only? Are there bus stops near the facility for transportation, et cetera? These are definitely important questions to have, especially if your loved one is in need of these types of resources, if they are placed in a group home. And here is my contact information.
So again, we'll have time for questions at the end, but are there any questions? Well, actually, I do see one in the chat. Maybe you can answer this, Zach. We have a question from Terry. Is there someone to talk to about what is the best fit for our loved ones? Someone or an organization to guide family members who have guardianship over their loved ones, for example?
Yeah, of course. I would say feel free to give me a call, Terry, or if you want to shoot me an email. We have a client navigator here at NAMI, Ohio. I know it's a little confusing between The two, technically the Ohio Adult Care Facilities Association is under NAMI Ohio, but our client navigator, Danielle Smart, she's a licensed social worker. She's really great with these things in terms of trying to find resources and find the appropriate types of placements that we can look at. But feel free to, give me a call or shoot me an email, and we can go from there if you'd like.
Great, thank you. I see some other questions here, but these may be more relevant to what Ellie is going to be presenting next. So I think we'll move to Ellie's presentation.
All right, thank you for having me. Let me go ahead and share my screen. Sorry, just give me a sec. Okay, great. So my name is Ellie Jazzy. I'm with the Ohio Department of Mental Health and Addiction Services. I am lead over the community transitions area, which is in the Bureau of Recovery Supports with Sue, and we work quite a bit with the housing and homelessness team. So basically, my area, we work to help support sustainable person-centered transitions so individuals can live and recover within integrated communities. So basically, our work is to support those individuals that may have a higher level of need, but are able to be in non-institutional settings where they can live in recovery. So our programs include the Recovery Requires a Community program, Residential State Supplement or RSS that Zach had mentioned. And then we also include the RSS verification process, which I will just touch on briefly. So just a brief introduction for the team. Basically, if you are to contact MHAS about applying for either the RSS or Recovery Requires a Community programs, you would be speaking with Megan. So we see her smiling there. And I will make sure that as part of the presentation that we share all our contact information as well. If you are already, if you have a family member, loved one that is enrolled in RSS, then it likely would be Dina Mavromatis who you talk to about current status, any changes such as address changes or that type of thing. So the first program I'd like to mention is Recovery Requires a Community. So basically this helps individuals who have some type of behavioral health diagnosis. So that could be mental health or substance use disorder by providing one-time or short-term financial assistance for folks who are transitioning from nursing facilities, or also known as nursing homes, to sustainable community living. So I mentioned this program because folks who enroll are able to live in a variety of settings, but that also includes those Class 2 residential facilities that we're talking about today. So the eligibility criteria for Recovery Requires a Community, basically the person needs to either be currently receiving treatment in a nursing home and planning to transition to the community, or it could be somebody who has recently discharged from a nursing home. Typically, we try to keep that within the last 90 days, but we can be flexible considering the situation. And if that person is at risk of readmission to the nursing home, we're really wanting to help people live in the least restrictive environment for their needs. The person would need to be currently enrolled in Medicaid, have some type of behavioral health diagnosis. So this does not need to necessarily be what is considered a severe and persistent mental illness. So just keep that in mind. Again, this program would be one-time or short-term assistance. So the person would need to have sufficient income or means to sustain community living at the time of transition. So the vast majority of folks who apply for Recovery Requires a Community typically are receiving SSI or SSDI most often. And then the individual should also have needs that can be safely met through the recovery program or a combination of community resources. Oftentimes the people that we work with, Recovery Requires a Community is only one of the programs that they're involved with. So just to keep that in mind. This is a program that is, the financial assistance is distributed on a reimbursement basis. So typically people are working with a behavioral health provider that can be the entity that's reimbursed. One thing I want to note is that recovery funding is very flexible and does not have a cap. It really is intended to address those immediate challenges that people are facing to transitioning from a nursing home to the community. So examples of that of assistance that we often help with could be housing, utility costs, goods and services. So many times people have, particularly if they've been in a nursing home long term, have lost most of their belongings, if not all. So we're able to help out with that so folks can reestablish a residence in the community. Home modifications, we're talking grab bars, handrails. We have been able to assist with wheelchair ramps in the past, transportation, and any other costs that an individual may need help with to transition. Okay, so I am going to go quickly through this application process. So our application forms for recovery requires a community are available on our department's website. Basically, anyone can submit an application. So if you're submitting an application on behalf of a loved one, we would review that, look at the types of assistance that you're requesting on behalf of the person, let you know about whether the award has been approved, which we approve. It's basically a 99% approval rating for folks that are coming out of nursing homes. So basically the referral source, whether that be a person or agency, they would submit those forms for reimbursement to our fiscal management agency, which is called Morning Sun, and they actually send the award funds as approved, typically within 2 weeks of receiving the paperwork. So again, recovery requires a community, not probably going to be used as often as RSS, but it is an option I would like you all to be aware of for folks that are looking at living in RF2s. So the other program that's in our area is the Residential State Supplement, or RSS. This is a program that provides not only financial assistance, but also Medicaid coverage to adults with low incomes. People who are eligible either have disabilities or are at least age 60, but do not require long-term care. So basically have that as people can have disabilities. It is not required that they have a behavioral health diagnosis to be eligible for RSS, but it just so happens that the majority of folks enrolled in the program do have some type of diagnosis and are connected with behavioral health treatment providers in the community. So RSS, again, it's the Residential State Supplement. So it supplements the individual's income to pay not only for housing, but also the supervision and personal care services and eligible living arrangements for the program. So those do include primarily the class 2 residential facilities, what we're talking about as adult care facilities or group homes today. So this is really for folks who have a higher level of need that may not be able to live independently at this time, but they are able to live in a non-institutional setting with those extra services that are provided by RF2s. Our annual budget, this is a statewide program, so our annual budget is $16 million, and we currently serve about 2,200 people statewide. And one thing to note, Cuyahoga County, consistently, we have, I would say, about a quarter of total individuals live in your county. So RSS has both non-financial and financial eligibility criteria. Applications are first received by us at Mental Health and Addiction Services, and we work with you to make sure the application is complete, that there is an eligible living arrangement selected, and work with Job and Family Services for that financial eligibility piece to be completed. So an individual needs to be 18 or older, either Medicaid eligible or currently enrolled in Medicaid. One thing to note, if your loved one is enrolled in a waiver program, they cannot be receiving a waiver and RSS. Typically, folks choose to go the waiver route in those situations. The person should be currently receiving Social Security, SSI, or SSDI. They need to have an income to be supplemented for the program. And the person needs to, their needs should be meet at least a protective level of care. So this is some terminology in Medicaid rules. Basically, with activities of daily living, people that are enrolled in RSS don't necessarily need hands-on assistance with bathing, grooming, that type of thing, but instead supervision. So for example, people would need to be able to administer their own medications. However, they would receive verbal prompting or supervision by staff at the RF2. Again, bathing, grooming, housekeeping, it would be more of that verbal prompting or supervision, and not the hands-on assistance that someone may need in a nursing home level of care. And then also choosing to reside in an eligible living arrangement. So those include the Class 2 residential facilities that are licensed by our department. Not all RF2s, I want to note, except folks who are enrolled in RSS. These are sometimes those facilities that choose to only accept residents who would be private pay options. So again, from our standpoint, any licensed RF2 is eligible. And also we do have some folks who live in assisted living that Sue had mentioned that's licensed by the Department of Health. And that's really for those folks who live in gap areas where there aren't really many RF2s, or they, may not have beds available in their area. Again, not really a situation that you all will run into in Cleveland. And then the financial determination piece, this is done again by the county Job and Family Services office. But I can tell you that the monthly income an individual may have to be enrolled in RSS is currently up to $1,300 a month. So with particularly the 2023 SSI amount of, I think it's about $915 a month, somebody receiving SSI would fall within that income limit, and then a number of people who receive SSDI as well. And then along with Social Security and Medicaid asset resources limits, you can have assets up to $2,000 per individual. So the application enrollment process for RSS, again, we have our application forms available online. Also, there is a link to our Bureau of Licensure and Certifications page, which can show you the most recent list of licensed RF2s. They have an alphabetical list and also a list by county, which I find is much more helpful for people to use. So those lists are on our department's website. So basically, our team reviews the applications, make sure that all the non-financial eligibility criteria is met. If a person is basically currently living anywhere except for a nursing home, then my team would then contact the local area agency on aging to do what is called a level of care assessment. So basically they meet with the person to talk about those activities of daily living, learn about medical, behavioral health diagnoses, to see whether or not they would be able to live in the community, or if they still need an skilled level of care that's provided in a nursing home. Typically, most folks that apply, I would say there are maybe less than 10 people a year who do not meet this level of care requirement. So really, it's making sure that folks are requesting an appropriate level of care for their needs. So once our team contacts the area agency on aging or the AAA, They conduct the level of care assessment and notify us of the determination. Again, typically, people are found to meet that level of care requirement. So as long as we have the move date, all the paperwork, all that is confirmed, then my team sends the information to Job and Family Services. And so they go into their computer system, which is called Ohio Benefits. They run all the eligibility, confirm income, assets, and they do what is needed in the Ohio benefit system to authorize the benefit, and RSS payments can get started. One thing I do want to note is when you submit an application, there is, it asks for representative payee information. Some individuals do receive their RSS benefits directly. It's an individual benefit. So that when they combine that with their income, then they're able to pay their rent to the operator. But some people we know do not handle their own finances. So the rule of thumb I really recommend is that if a person has a payee, whether it be a family member or a representative payee agency, if they have a payee for, say, their SSI, then I typically recommend that that same person or agency also be representative payee for RSS. One thing to note here is that RF2 operators and staff may not be representative payees for RSS. It's not a housing voucher, but an individual benefit. So that needs to go either to their to the person themselves, a payee, or legal guardian. So how is the RSS payment calculated? So an individual may be charged $1,100 per month for to live in an RF2. So I will go, actually, the next slide, I think, explains this a bit better. So we call that the allowable fee or rent. That's $1,100 a month that would go to the residential facility. Part of the RSS calculation is that somebody have $200 per month to help cover their personal needs. So that may go for co-pays. If they do have a payee, the payee agency fee would come out of that, and other things. Toiletries, I mean, this is really they're spending money for the month. And we have found that it does cover things, since meals and snacks, and then housing is also covered by the facility. So that is how we get to the financial eligibility limit of $1,300 a month. So an example of how much somebody would receive in RSS benefits, say for the person who's receiving SSI, again, that income limit is $1,300. So minus their income of $914 a month in SSI, then their RSS benefit amount would likely be about $386. So again, they would be able to use that combined with their income to pay $1,100 to the residential facility, and to have $200 remaining per month for their personal needs allowance. So responsibilities of the living arrangement or the residential facility. So what is included? I mentioned earlier the accommodations, supervision, and personal care services. So accommodations include housing, those meals and snacks, laundry, housekeeping, that type of thing. Supervision, again, making sure that residents are able to complete their activities of daily living in a safe and healthy way. Any reminders of self-care, possibly assisting them with making and keeping appointments. And then personal care services, really making sure that folks can complete that self-administration of medications, helping prepare special diets. So for example, if someone has diabetes, then they would be, the facility should be working with the individual to make sure that they have a special diet to that they can, have for their condition. And then these are the websites and contact information for everyone. Again, I'll be sharing this presentation along with the others, but I would like to, I'm gonna stop sharing and see if we have any questions about recovery or RSS.
Yes, so we did get a question from Joni. This is a good question. Can a client or their guardian have their official residency in Lorain County, for example, but apply for a Class 2 facility in Cuyahoga County?
So I'm gonna guess, so the guardian may live in Lorain County, but the individual wants to live in Cuyahoga County. That would be fine, as long as the guardian is okay with that. The only thing I can think of with RSS is that if the individual currently has Medicaid being administered from Lorain County JFS, then we would work with the person as their RSS application is being processed for JFS to transfer their case from Lorain to Cuyahoga.
Thank you.
Thanks.
We do have one more set of slides. I think we'll allow Allison and Vince from the Cuyahoga County Adams Board to share their presentation, and then we'll have some time after that for final Q&A.
Thank
Great,
you,
thank you.
Matt. Just give me a second to share. Okay, so you guys should be able to see that now. So I'm Allison Schaefer. I'm the Director of Adult Behavioral Health Programs at the Adams Board of Cuyahoga County. So I'm going to give you a little bit of overview, a very brief overview of a big umbrella on what we do here at the Adams Board. And then Vince, who will introduce himself, is going to talk a little bit further about our residential assistance program as it applies to Class 2s.
Yeah, oh,
Okay. All right, a little bit about the Adams Board. So the Adams Board was established in 2009 through a consolidation of the Cuyahoga County Community Mental Health Board and the Alcohol and Drug Addiction Services Board of Cuyahoga. So initially, these were two separate boards that operated for clients in Cuyahoga, and in 2009 combined. And we're one of many in the state. I don't know the exact amount, but there are over 50 boards in the state that have varying names. Some of them are ADAMH, some of them have the MHRS, but there are over 50 boards in the state of Ohio. And we're a quasi-independent part of the county government. So what that means, we operate under Cuyahoga County, but we do have our own volunteer board of directors who make funding decisions for the Adams Board. So our board of directors consists of 18 members, with 8 being appointed by the Ohio Department of Mental Health and Addiction Services and 10 by the county executive or county council. And I also want to note, as far as the board, there are some requirements around individuals who have to have experience as clinicians in mental health and substance use disorder, as well as individuals with lived experience and family members of individuals with lived experience. So just really briefly, our responsibility, mission, and vision. So our responsibility is planning, funding, and monitoring of behavioral health services in Cuyahoga. Our mission is to enhance the quality of life for our community through a commitment to excellence in mental health and addiction prevention, treatment, and recovery services coordinated through a person-centered network of community supports. Our vision: mental health, addiction, prevention, treatment, and recovery services will be available and accessible for every Cuyahoga County resident in need, and that the Adams Board will provide a preeminent, seamless, and integrated system of care. And just to dive a little bit deeper into the recovery-oriented system of care, our focus first and foremost are clients and their family members. We emphasize the importance of peer supporters, employment supports, housing, and transportation. And we'll be talking a little bit further about one of our housing programs in a few minutes. And we call for services that are culturally appropriate and delivered in an accountable, effective, and efficient manner. And this often surprises a lot of people, but we don't provide direct service to clients. Our role is to plan, fund, and monitor. So what we do is we contract with 70+ provider agencies that deliver services for those in need with behavioral health diagnoses in Cuyahoga County. So what we fund are people who are not covered by insurance or Medicaid, so individuals who don't have insurance and need behavioral health services. And we also pay for recovery supports that aren't traditionally covered by insurance or Medicaid. And below there's a few examples of that. Housing being one of them. I know that was discussed a little bit earlier in the presentation, but housing, crisis stabilization. We have various employment programs, peer support, prevention, education, information and referral, detox, client rights, and transportation. Just some of those. And a little bit of data on how many people we served in 2021. Hopefully these will be updated to reflect 2022 very soon. But we served over 173,000 adults and children with non-treatment services. That's those recovery supports that we talked about in the previous slides in 2021. And this kind of breaks it down. And I know you guys are going to get the slides after what kind of services were provided to how many individuals. And then we also provided 7,458 individuals with treatment services. So those are individuals who either were not insured or were underinsured that needed to access behavioral health services in Cuyahoga County. And this is something that we do on our website that's open to anyone. We provide free confidential online behavioral health screenings, which are a quick way to determine if you or someone you care about should connect with a behavioral health professional. So you could follow this link to go there. If you go to our website, these topics on the right, you can click on whichever one is applicable, and there'll be a brief questionnaire that you or the individual in your family, your loved one, can fill out and do a quick check-in. Note that it does not give any recommendation for service. It's just a check-in. We always like to talk about our various helplines. So Frontline Service operates our 24-hour suicide prevention, mental health, addiction, crisis information, and referral hotline. And that number is 216-623-6888, or also 988. If you dial that, it's directed to that line. So that line can be called for any of the above. So whether it's crisis, information, a lot of times if you don't know where to turn in the community for various services, that hotline should be able to help you, and they can also provide various referrals. We also have the crisis text line, which is listed here. And then Thrive Behavioral Health, which is a peer agency, provides our 24-hour warm line, which is operated by peer supporters. Just if individuals are looking for someone to talk to or need a little bit extra support, they can reach out to that line and connect with a peer supporter. And then also we have listed the Ohio Care line for emotional support. Our website, if you go to our website, which is adamcc.org, and the link's right there, and you're looking for a specific service, you can go to the Finding Help tab, and that's a screenshot there of what the top of our website looks like. So if you click on that Finding Help tab, you can search different services that are available in Cuyahoga County in different ways. It's actually pretty cool. You can look for the specific service, you could search by area, you could search by age, all different kinds of things you could search by to find various services in the community. So that's a cool tool to have available. All right, and that is the very brief overview of what we do at the Adams Board of Cuyahoga, and I'm going to pass it over to Vince to introduce himself, and he can provide information on our residential assistance program.
And I appreciate you guys having us on today. I'm even learning a lot from all of the other presenters who was able to give their information, but yeah, I just want to jump in. My name is Vince. I am the adult behavioral health specialist here at the Adams Board who oversees housing. And I'll jump in and kind of give an overview on our RAP program. The Residential Assistance Program, which we refer to as RAP, is intended to provide temporary financial rental assistance for low-income adults. The clients must be receiving TBS or CPST services. These folks maybe also be referred to as like case managers with the community mental health agencies. And those mental health agencies have to be a provider and contracted agency with the Adams Board. The rental assistance program will allow the client to reside in and receive support services from an Adams Board contracted Class 2 resident facility, also known as the ACF, in the community. RAP is targeted for low-income adult clients who are discharged from an institutional environment. That this may be a state hospital, private hospital, Cuyahoga County Diversion Center, nursing home, or the jail or the crisis stabilization unit. Kind of like the state's program, the cost of living could be expensive for, you know, a lot of our adult clients who need a Class 2 residential facility. RAP, in a sense, helps supplement that payment. Allison, you can go to the next slide. Okay. So the RAP program has its process. The CPST or the case manager and the client complete the RAP application in its entirety. The RAP application is then submitted to the case manager's supervisor for review and the treatment team's recommendation and signature. The CPST or the TBS worker submits the completed RAP application to the Adams Board at rapapplications@adamscc.org. And when we say in its entirety, there's other required documents included, but not limited to, you know, verification of Social Security or other income, copies of the last 3 bank statements, or a notarized statement of no bank account. If the client receives Social Security benefits, the RSS program must be applied for, and we must verify that that application was applied for to go along with the RAP application. Once the completed RAP application is received, it is reviewed by the Adams Board resource specialist. And please note, if the RAP application is incomplete, it will be sent back to the CPST worker or the TBS worker, and the application will be on hold. Once all required documentation has been submitted and the RAP application is approved, the Adams Board resource specialist will draft and send notification of approval to all parties involved. That would be the CPST worker, that would be the supervisor, the agency's housing liaison, which each contracted mental health agency has a housing liaison. That the draft of the approval will also be sent to the group home operator, the payee, and also the Adams Board Finance Department. The notification breaks down financials for RAP, and that's the client's agreed upon payment, the Adams Board's responsibility, and also the PSA, which we refer to also as the personal spending allowance, if it's required for the client. Next slide. And now I'll go into detail what the PSA is. The clients with 0 income are eligible to receive $200 monthly spending allowance. The PSA check, approval of the PSA will be indicated on the Adams Board notification. It is the provider agency's responsibility to notify the appropriate parties at their agency of the client's PSA check. CPST and TBS workers must work with the client receiving the PSA on a monthly budgeting log and submit to the Adams Board. And again, that budgeting log is just a brief explanation on how the resident would utilize the $200. Folks can use it on basically anything that they need, but, you know, just kind of working on budgeting for that potential resident so that they can, you know, have that skill moving forward. Next slide, Allison. So once the resident is a RAP client, it's a lot of communication that needs to be done between the mental health agency and the Adams Board. So the Adams Board shall be given at least 5 business days to process that RAP application. CPST, it's the CPST's responsibility to submit the PSA budgeting log monthly. It's the CPST is to work with the housing liaisons with notifications of client changes, which that can include the client needing to move, that could be a change in income, any changes like that should be reported to the Adams board. The CPST and TBS worker is required to notify the Adams board immediately of any of the client updates. Again, if there's any change in income, if the client moved out of the facility, if the client needs to switch group homes, or if there's a recent incarceration or something like that, it is important for us to be notified, as different from other client assistance, well, financial assistance, like from the state. Our funds from the Adams board goes directly to the ACF operator. The agency housing liaisons are required to attend the Adams board quarterly housing liaison meetings, where we kind of go over any barriers that may be in the way of this communication, any trends that happen between residents who are trying to move in and out of Class 2 facilities. We can move on to the next slide. So ACF or Class 2 peer seal of quality. So conducted by a peer support specialist to assure that the Class 2 residential facility is operating and meeting the standards of living at each site. In 2022, the Adams board contracted with Thrive Peer Support to conduct peer seal of quality walkthroughs. During walkthroughs, peers confirm compliance with the peer seal quality checklist. Next slide, and we'll kind of go over the items that are on that checklist. On the checklist, the peer supporter will check the exterior of the home, making sure that the yard, the steps and things are free of debris and safe, making sure the home is aesthetically pleasing. Interior safety, making sure that there's working smoke detectors and CO2 detectors. Make sure that there's a present fire extinguisher, making sure all of the emergency phone numbers are posted and there's access to a phone. Bathrooms, they must appear to be clean and well maintained. The bathtub or the shower must be free of mold. The bathtub or the shower must be on a non-skid surface, and there must be basic hygiene items available for use for the resident. I want to say this checklist continues. Yep, the peer support specialist checks out the kitchen, making sure that the appearance of the kitchen is clean and well maintained. Clean and working appliances, sufficient cookware and silverware. Residents have access to an unlocked refrigerator, and that there's an adequate supply of fruits and vegetables, fresh fruits and vegetables, not just frozen fruits and vegetables. In regards to the bedrooms, making sure that they're clean and aesthetically pleasing. Clean mattresses and box springs that are on the frame, not sitting on the floor, and that there's adequate drawer and closet space. Next slide. Yeah, again, going back to the checklist, the peer supporter will check the general living spaces, making sure that it's clean and aesthetically pleasing, clean furniture that's in working condition, free of insects and any type of infestation. Cleaning supplies are properly stored, medications are properly stored away, and residents' rights and grievances are and the procedures are posted. Next slide. Okay, and here we have listed our clients' rights. The Adams board has clients' rights officers who can be contacted below. We have Bill Hebel and Christina. So sorry, I struggle with pronouncing her last name, but their email addresses and our phone number is here on the screen. Next slide, please. Questions. I want to say from one of the previous presenters, we went through a lot of the questions, the general questions that are asked. Hopefully through it, we were able to answer some of them. I know one of the bigger questions is, the location and the safety and things of the homes. And I want to say here at the Adams board, we do everything that we can to make sure there's no hazardous situation or any we want to make sure that no one is putting a loved one in a bad situation in regards to location and safety. So yeah, that and again, going back to the wrap portion of the presentation, Class 2 living can be expensive, and our wrap program is there to step in and help with making class 2 living affordable.
Thank you so much to the Ohio Department of Mental Health and Addiction Services, and to the Cuyahoga County Adams Board, and to NAMI Ohio for joining us for this presentation. I hope it was informative for everyone, as informative for everyone that joined us as it has been for me. We do still have all of our presenters here with us, so we're going to open it up now for any general questions. I know we were able to address several questions during the presentation, but basically now the floor is yours to those of you that have joined us. I'm also going to put in the chat the link for the survey for today's presentation. We really appreciate if you can complete that for us. It is anonymous, very short. Demographic questions are optional, but do please complete that, because it is partly what allows us to continue to offer programs like this that are free and open to the public, because this information is given to our funders, which includes the Adams Board. So yeah, any final questions for any of our presenters before we conclude? Just seeing some nice comments that this was really helpful. So that's great to hear. And again, this obviously is being recorded. You can go to the NAMI Greater Cleveland YouTube channel later this week and you can view the recording. And also I'll make sure I email you all the slides later today. And we did get a question from John. How does one become a Class 2 facility or provider? Anyone care to answer that?
So they are licensed by Mental Health and Addiction Services. I will have a look there. That's under our Bureau of Licensure and Certification. So I will try to find the exact webpage that you can go to for all those requirements. And Sue can probably answer this better than I can. Thanks.
If you are interested in becoming a provider, Zach and I in licensure and certification do a new provider training every quarter, and we're happy to send you some information. If you put your email in the chat, I can send you the information that we send out to new people interested in becoming a provider. And then I would attend that training to get more information.
Got another question in here. I'm not sure who might be able to, who has the answer on this one. Who can we contact about permanent supportive housing applications in Cuyahoga County?
Tracy, are you referring to an application that was already submitted, or you're looking to fill out an application?
Hi, Allison. Yeah, general information that I could share with my team in what it is, you know, who would qualify and how to do it.
So I would say your best contact there would be Frontline, their coordinated intake, because all referrals go through them.
Perfect. Thank you.
Sure.
And it looks like John put in the contact information for the person wanting to learn more about how to become a provider and operator. Any other questions? Just seeing more nice comments that this was very helpful. Thanks for that feedback. Definitely fill out that survey for us, letting us know that that's how you felt about the program. We appreciate it. And if there are no other questions for any of our presenters, guess we can end a little early and let you go about your day. Thanks so much for our presenters sharing their expertise, generously donating their time to join us today. John, you'll get the slides in an email afterwards. And like I said, these will also be posted on the, this webinar will be posted on the YouTube channel for NAMI Greater Cleveland. So thank you all. Have a great day.
Thanks, everyone.